My name is Maria Arini. I'm a physical therapist at both Bethesda PhysioCare and PhysioFitness. PhysioFitness is very different because it has a lot of equipment in the gym itself that is engaging. And the thing that I like the most about it is the clients are focused more on beating themselves, being competitive with themselves, trying to beat their last score, or even more competitive with other patients. I do a muscle relaxation technique called dry needling, where I insert a tiny, solid, thin needle into the trigger points in the muscles. They're like muscle knots, and it helps to release the muscle and helps to decrease the pain, muscular pain that these patients are in. In addition to that, I do a lot of strengthening, generalized strengthening, balance work, proprioceptive work down in the gym with the equipment down there.
Yes, but no.
The tracer is another piece of equipment that I call it the Wii on steroids. It basically is a big game on a huge screen in front of you, and it has a sensor that detects where your body is in space, and it can kind of track your motions. And a lot of people find this very useful, especially with EDS. You don't have a very good idea of where you are in space. So that proprioception, that ability to recognize where your joints are in space in order to get more points for this game, is a really, really good feature. I use that quite a lot. Kinesiophobia is a fear of moving. And a lot of times with the type of clientele that I typically work with at PhysioFitness, they have this disorder called Ehlers-Danlos syndrome. And they have very loose connective tissue in the joints and throughout the body. And they tend to end up spraining a lot of joints, ligaments. They actually become afraid to move. And so they start to tighten up, they start to stiffen up, and they don't want to move. I had this one lady who, she would not go up and down the stairs for the life of her. And as she realized she could do things, as she realized she was getting stronger, now she can go up and down the stairs without pain. The focus is external. It's not, okay, you need to do this and lift your leg and lift this number of weights and this many repetitions. It's more about a functional movement and having fun when actually exercising.